Hello and welcome to ThinkUp. I'm Tina Fassetti, Chief Creative Officer of the agency network at MJH. Our guests today from Biolumina are Dorothy Chin, SVP, Group Creative Director of Copy, and Austin Wei, EVP, Group Creative Director of Art. They are the winners of a Pharmaceutical Executive APEX Award for their campaign, See Breast, Think Brain. Congratulations on your win. So happy to have you guys here. It's a pleasure. For those that don't know about the APEX Awards, they're the only award show judged by healthcare professionals and patients. And for us, I know those of us that speak to these audiences, it's very important that we have an opportunity, and we were talking about this earlier, to have those folks be the ones that judge the work that we do. So I'm so excited that you guys won, and I'm really here to talk about and share with the audience what happens behind the scenes of a campaign like See Breast, Think Brain. So I'm going to dive into the questions. First question is, what were the competitive or insight market dynamics that led to the creation of the campaign?
Yeah, I mean, I think for us, when we start with a creative campaign, we like to look at the data and the insights and find something that seems like it's going to be meaningful to our customers. This is HER2 positive metastatic breast cancer. So our customers are oncologists. They're people who are, treating these patients day in, day out. And I think what we were finding was that there was a little bit of a disconnect between the perception of the oncologist in terms of just how many of their patients end up going on to, develop brain metastases. So that sort of was the impetus of the campaign and the insight that went into it. Almost up to half of their patients would eventually go on to develop brain mets, and a lot of oncologists just simply didn't realize that it was as high as that. So that's sort of the starting point for where this came from.
Wonderful. So next question, what were the main objectives of the campaign?
I think the objective was just to generate a sense of awareness and a sense of urgency behind wanting to do more for people who have metastatic breast cancer. And I think part of that is, if you think about a campaign objective and you're thinking about driving awareness and a sense of urgency, we wanted to disrupt the current thinking and disrupt, a little bit of the behavior and the mindset. I think it is a little bit of a watch and wait sort of mentality. And that's simply because when we set out to launch this campaign, and for years and years, there really hadn't been a lot of effective treatments for brain mets in people who have metastatic HER2 positive disease. So without having an effective treatment, it's understandable that there wasn't as much of a sense of urgency or a need to address it from a therapeutic standpoint.
Wow. So tell me a little bit about the inspiration behind the actual creative campaign.
Yeah, I think one of the things that we found fascinating really was that initial stat that Dorothy had mentioned, that 50% of patients will eventually go on to experience, brain mets, and so that was something that we really latched onto actually from the moment we pitched this piece of business, and so we thought that that was something to really highlight and really tell a rich story around, and we thought that that could be something that we could illuminate and create that sense of urgency that we really were setting out to do, and really shifting the mindset.
Yeah, it definitely has a call to action that you can't ignore, and I think that's what was really, to me, it was stopping power, and it was very attention-getting. So can you walk us through, I think some people want to know sort of what's behind the scenes of your creative process, like how do you go about from, start to finish, what your strategy is, now you're ready to get started. So tell me a little bit about that.
So at Biolumina, we really feel that the work we do matters. That the field that we work in oncology it's so impactful. It's evolving every single day, and there's exciting new innovations that are occurring. So we really feel that the creative needs to have that same level of excitement and purpose. So we have a mantra of creative with purpose. So everything that we do really does have to befit that type of mentality, be as bold and exciting. We really, it comes down to the brief. We start and we really try to hone our story down, and essentially the core idea is the area that we really start, and we figure out what is the one key point that we want to communicate. And I think for this core idea, it was stay ahead while you still can.
Yes.
So you can see how we start there, and then from there we just start to ideate, and we figure out how do we want to tell this story? What different lenses do we want to take? Do we want to have more stat driven? Do we want to feel a little bit more emotional? All of those. We almost take a different lens of storytelling, and we see where it takes us. And so that way we have a nice range all centered around this singular narrative.
I love how the strategy has a sense of urgency and you delivered on that in the creative idea without repeating the strategy. You know what I mean? So I thought that was, it's nice to hear the strategy because you definitely delivered on that in the creative execution. So, and do you normally have several teams, or is it just, a smaller team? Or?
Yeah, we usually have all, obviously it's a lot of times dependent on the budget and the timing, but
I know.
but we definitely have a lot of different teams. We like having fresh thinking because we never know where that nugget of an idea can start. Actually, it was interesting. This particular idea, we had two creative teams develop almost, identical concepts.
Really?
And
Oh,
so
wow.
we knew we were onto something really, really impactful. Just knowing that two separate groups were already latching onto this narrative.
That's interesting. When that happens, you have to, like you said, you have to stop and pay attention to that and say, wait a minute. So how did you measure success of this campaign?
Yeah, I feel like success for us was firstly, developing something that just for ourselves felt like it achieved that mantra of creative with purpose. I think it's so important that we're happy with the creative and the work. But then, secondly, we kind of look, a little bit outward. From a metric standpoint, are we achieving what we want to with this campaign? It's primarily non-personal promotion, so that means we're looking at a lot of digital and social channels, some print collateral. It's not really Salesforce driven, so it needs to measure high in terms of stopping power and making sure that it's able to grab that attention and disrupt. And then lastly, our customers, of course, this being the APEX Awards, having oncologists react well, and we find that out through research, but also through feedback once it's out in the field.
Right.
Are they reacting positively to it? Are they having meaningful conversations? Those are so important for us when we think about, is this campaign successful?
Yeah, absolutely. And so, assuming you did market research, and I'm not sure how many you tested, but what was the thing that made this particular idea sort of rise to the top? What do you feel was the feedback that got it there?
Yeah, I think we just started to see that it really resonated, with our customers. I think we saw that what was really interesting about it was that our customers, these physicians, they recognized, the imagery. It felt familiar to them, but we subverted it, and it was able to really start to turn it on its head. And I think that had a stickiness to it that had them want to find out a little bit more and figure out why were we overlapping a brain scan on a breast scan. Why were the tumor hotspots really overlapping, and what was that visual? It was very intriguing to them, and I think that was something that we were seeing in market research a lot.
Yeah, it's hard to hit that mark of something they're familiar with, which may not be very exciting, but then to do something different with it that makes it so ownable that it's getting their attention. So I think that's that's wonderful when that happens. That's kind of magical when you can relate to them, but then also have them be like, wow, that's stopping power, and that's not something I expected to see.
I think it's the connection between first it's visual, you hook them in, and then you get them to look twice, and then you get them to think twice about it,
Right.
and I think that's the connection that ultimately then drives the message and then the behavior change.
Yeah.
Yeah, we always talk about what's that hook? How are we twisting the story, and how do we turn it on its head? And ultimately, we find that if we are able to lead our customers to a place where they're learning our story, we're not telling it to them, but they are actually staying with it and thinking about it, and then learning that story on their own, it truly does resonate more, and they internalize it more.
So you kind of answered my next question in that. The other point was, what were some of the most measurable responses and reactions, sort of in market research?
We take a look at looking at qualitative feedback during the research process.
right.
We want to hear from them whether they feel like the visual and the message are going to be impactful. Do they work well together? Is it something that is going to be compelling, grab their attention, and then ultimately drive an action of some sort?
Right.
I think for this campaign, we wanted to make sure that they understood the urgency behind it and the need to not only consider brain metastases with their breast cancer patients, metastatic breast cancer, but also, acting on it if possible. Then we kind of, after it's launched, we're constantly looking at the metrics to see how it's performing, and everyone is always keeping tabs on how it's doing, especially as this is a non-personal promotion campaign. So I think what we saw was, very quickly within the first 3 to 4 months of it even being out there, it did have a lot of engagement. I think it was something like 10,000 unique visitors just to that
great.
site in just a short period of time. So, the metrics I think were working well in our favor, but we were also hearing from the sales force that they were really excited about the campaign. And even though this is a disease state awareness campaign and they're not actively promoting the campaign, but I think they were starting to get a lot of questions and it was sparking a lot of conversation. So it was working well to support their efforts from a sales perspective.
It's just so fascinating how much they need to know and learn in this field right now.
There's a lot of, I think Austin was saying this earlier, a lot of innovation, a lot of advancement, and it can be so hard for an oncologist to stay on top of every single advancement in innovation,
know, right?
and they're oftentimes treating different tumor types as well. So just a little something that I think is a nice reminder of what's new and up and coming and what the buzz is about is so important.
And the data is always changing too, every single day, and new data is being released. So the way you look at certain products can change. It might be the same products out there, but the way we look at it and the stories that are being told about them, the narratives start to shift.
There's also an interesting relationship between their personal experience and the data that's out there. And I think, that translation between, what the data is telling you and what your, clinical practice may show is so interesting, because I oftentimes find, a lot of oncologists, they lean into the successes that they've had, which is absolutely natural, and it's so great to see that they've had so many successes. But then there are many patients who are, left behind because of lack of innovation in treatments and all kinds of other factors that are just not related to the oncologist, but just to what's available out there.
Exactly. Exactly. What lessons did you guys learn from this?
Yeah. I think one of the things that we learned was really understanding the customer, and really trying to figure out how to speak to them. Again, this campaign hinges so much on turning what feels familiar to them on their head. I think the biggest lesson we learned was really the power of using the language or the visuals that are familiar to our customers, and so that we can meet them where they are and help to try to tell that story, and help them learn that story in a stronger fashion. Yeah.
I love that. I love that. And one more question. What other tactics did you, I know it drove them to a website. Were there any other tactics? And then leading to that as well, was there a launch campaign that followed this particular disease state awareness campaign?
Yeah, we had this campaign was living in banner ads and social media, and we had certainly digital drivers that were driving to a microsite for this, as well as some print materials. The product had already been launched, so this wasn't necessarily leading to the launch of our client's treatment.
Absolutely. Yeah, disease state awareness can happen before, during, or after launch. They happen whenever they need to happen, when people need to be educated. This has been terrific. Thank you guys so much for your time. Congratulations on the award win. It's definitely well deserved. Definitely a powerful, impactful campaign. And I loved hearing, behind the scenes. I do this too, and so I love hearing other stories from other creative directors and how you go about really making a difference for patients and physicians in this industry. So thank you.
Thank you.
Thank
Thank you for
you.
having us.
Absolutely.